New details today on the connection between the man accused of setting a fire that damaged a Portland City Councilor's home and Oregon's flawed mental health care system. Portland police arrested Vashon Lacoste this week. He's charged with reckless burning. Police say Locust is a homeless man who lit a fire to stay warm, but that fire spread, burning Councilor Candace Avalos' car and home. Investigator Evan Watson joins us now to explain how Locust's history really shows the gaps in Oregon's ability to provide this needed care. Evan?
Yeah, Locust has a long criminal history of mostly misdemeanors and some felony drug charges. Multiple times, judges have ruled that Locust needs mental health treatment before his criminal cases can move forward. Time and again, Oregon's system hasn't found the right solution, as we've covered in our investigative series, Uncommitted. When an October fire destroyed the car of Portland City Councilor Candace Avalos and damaged part of her home, Avalos and others worried it could be an act of political violence. Instead, the case appears to be another example of the gaps in Oregon's mental health care system. Portland police investigators used this video showing a man walking away from the fire to connect the case to Vashon Lacoste, a homeless man who started a fire to stay warm, police say. Court documents show Locust has been unable to get the right treatment or assistance for years. Multiple mental health evaluators have diagnosed Locust with unspecified schizophrenia or another psychotic disorder. In early 2024, Multnomah County Judge Nan Waller ordered Locust to the Oregon State Hospital, ruling that a hospital level of care was necessary due to public safety concerns and Locust's symptoms. Waller previously talked with KGW about how Oregon lacks access to the right level of care for many people.
So I think that it's a combination of not having the whole continuum of placements and treatment available. We know that for some people, at least to get them stabilized, they need to be in a secure setting.
About 10 weeks later, Locust was released from the state hospital, ordered into community-based restoration and treatment in Portland. Court documents show that shortly after Locust arrived at that facility, he left. He missed court dates and treatment requirements. Waller issued a warrant for his arrest. The step-down plan from the state psychiatric hospital didn't work.
I absolutely know that we don't have in the communities the level of the right kinds of placements across the whole continuum, from low barrier to secure. It doesn't exist.
Months later, officers arrested Locust. Finding him still too mentally ill, Waller wrote that, based off the assessment of forensic diversion, the defendant is not a good candidate for community restoration at this time. Locust had already been to the Oregon State Hospital and couldn't go back there, so she dismissed the criminal charges and let Locust go. About a year later, Locust told investigators that he lit a fire to stay warm. It was cold. His clothes were wet. He wanted to sleep. He tried to stomp it out when it spread, but it didn't work. He left with it out of control. After his arrest and arraignment this week, Locust was released from custody. A pretrial hearing is set for later this month.